Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. We are here with another great guest this week. Thank you for joining me. I am here today with Dr. Martinez, who is a neuropsychologist or memory specialist with the Neuropsychology Center in Peachtree City, Georgia. And today we are going to talk about dementia, Alzheimer's, getting a diagnosis, some important treatment options, what the role of a neuropsychologist is, and much, much, much more. So if you or anyone you know are suffering or seeing signs and symptoms of forgetfulness and memory loss, please stick with us because we have some great and very important information to share with you today. Dr. Martinez, welcome. Thank you for joining me this week.
Thank you for having me.
So first, I'd like the folks listening to kind of get a background of you. How did you decide this was the area of medicine that you wanted to get into? How long have you been in the business?
Okay.
Give us a background.
I'm a clinical psychologist by training, and then I received additional postdoctoral training to become a neuropsychologist. And neuropsychology is the area of psychology that deals with brain functioning, memory, cognitive functioning. And so I have been practicing neuropsychology for about 15 years and have been in Georgia and in the Peachtree City area for about 6 years now.
Are you you're not from Georgia?
I'm originally from Miami. My heritage is Cuban, so I speak Spanish. It's my native language. And my family and I decided to relocate to the Peachtree City area because of the quality of life. And I established my practice there, the Neuropsychology Center, 6 years ago, and we're very happy there.
Oh, that's wonderful. So before we get into what you do, let's discuss. You mentioned that you were a clinical psychologist and you went on to get your neuropsychology degree or credentialing training. What is the role of a neuropsychologist?
Okay. Well, as it relates to memory loss and dementia and older adults, a good part of what neuropsychologists do is examine individuals, hopefully when they're just beginning to experience problems with memory. Sometimes individuals become aware of these problems themselves. Other times it's family members who notice that the person is just a little forgetful. Maybe they're forgetting recent conversations. Maybe they're repeating themselves. And they're the ones who bring the individual to our attention.
So let's talk about that, because when folks come to see you, is it typically directly from then the actual person with the memory loss and the caregiving? As you mentioned, I was wondering if doctors referred to you for help.
Yes. The vast majority of my referrals and those of a typical neuropsychologist come from physicians. Many of those referrals are from neurologists who already have examined the patient and done a portion of the workup that's necessary. Other times, patients come from primary care doctors or other specialists. And, of course, there are some word-of-mouth referrals as well. People tend not to talk about their memory problems the way that they do about other problems. For instance, you may have a friend tell you that she was diagnosed with diabetes or with high blood pressure, but it's less likely for people to talk about being diagnosed with having dementia or Alzheimer's. So that mode of transmission in terms of referrals is less common.
Yeah, that's so tough because there is such a stigma behind it, and no one wants to think that their brain is not functioning correctly. You're right. And so the stigma with any kind of memory disease, Alzheimer's, dementia, and we'll get into the different types later, this is a very difficult disease right from the onset. It's just such a journey.
Oftentimes, even during the first session, when I first meet with the patient and family members, I will mention Alzheimer's as one of the possibilities of what may be going on. And in a sense, it's to begin to desensitize them to the idea that they may have Alzheimer's. And you're right, it's a dirty word. People don't like to talk about it. People many times stay away from my office because they don't really want to find out what's wrong, with the sense that it's a hopeless and helpless sort of a situation.
And let's talk about that. I have so many other questions too, but while you said that, I want to go right to that. How the earlier the diagnosis, I'm sure, the better in terms of treatment and maybe holding the disease at bay. Is that correct?
That's accurate. They've shown through studies that the earlier that we address this disease, the better. We don't yet know if treatments are truly changing the course of the disease. At any one point in time, a person who's being treated with an Alzheimer's medication will be thinking more clearly, thinking better at that moment than if they weren't on the medication. So there's certainly a quality of life issue that even if these medications at best are what we call symptomatic, meaning that it's just helping the symptoms rather than the disease process, I think it's worthwhile for the patient to be treated.
But are there studies to see, I'm sure, that earlier treatment leads to holding the memory loss at bay for longer or whatever?
Yeah, honestly, the results are mixed as far as to whether these medications actually change the course of the disease. And so in some studies, it suggests that, yes, it makes a big difference to treat people early. But aside from that, I think just getting their quality of life to be better than what it is, it's an important enough reason to start treatment early on.
Absolutely. And years ago, I worked with a doctor up in Rhode Island. His name was Dr. Stukides, and he dedicated his entire life to patients who had neurological diseases like dementia and Alzheimer's, and he had a memory clinic. And so what I also want to know is if you diagnose early, outside of traditional medicine medications that can help, are there other positive results by learning earlier, like doing certain triggers to help your memory and keep your brain moving and get those synapses going because we've diagnosed early and we can give you some other tricks on memory puzzles or whatever?
Sure.
Is there anything out there that shows that?
Well, there's good studies to show that there's several lifestyle factors that contribute to decreasing the risk of an individual developing dementia and Alzheimer's. And the things that we know are helpful are maintaining a high level of physical activity and exercise, maintaining a high level of mental exercise or remaining mentally stimulated. We know that consuming a healthy diet also is helpful. And believe it or not, we have good studies to show that moderate alcohol consumption also can be helpful in decreasing risk of Alzheimer's.
Well, there's a silver lining. Everything comes down to exercise and eat well. Lord, we just got to get moving, people. That's
true. And I try to impress on my patients that although that just seems like general good advice that doctors have been giving patients for many years, there really is a truth to it, and there's research support for this kind of a thing. So it's not just generic advice that I'm giving. I'm giving advice based on the knowledge that we've accrued in my field, showing that these things really are helpful for patients. They really do make a difference. And so there are studies that begin to follow individuals in their late 50s or early 60s, and they follow them up over the course of 8 or 10 years, and they find that those people who are the most active in relation to those that are the least active have lower rates of developing dementia and Alzheimer's. So there undoubtedly is something about exercise and keeping an active mind, an active body that makes a difference in terms of outcomes. What exactly makes the difference? We don't know. And we don't know which is the chicken and which is the egg. Is there something about people who are more active, who are already less likely to then develop Alzheimer's? Right. And there are some very interesting research studies to suggest that Alzheimer's changes begin in our brains when we're in our perhaps early 20s.
Wow.
I don't know if you've ever heard of the NUN study. It's being conducted up in, I believe, Minnesota. And they have found that nuns who wrote essays to join the convent, and those essays were more chock full of ideas, not necessarily lengthier, but had more ideas in them, were less likely to develop Alzheimer's 70 years later.
So something about the creativity in the brain could help decrease, like more creative people maybe.
Seemingly, or maybe Alzheimer's or very, very early stages of Alzheimer's already were taking a toll on the brains of these young ladies. And so really, again, it's hard to know what the connection is between one or the other. But I know that I try to do the best that I can to live a life like I'm recommending that my patients live, and that is trying to keep a good diet, trying to exercise as much as I can. And I've got to tell you that I also enjoy an alcoholic beverage per night, typically red wine, and that's still in the works, whether just plain any type of alcohol will help. And I should say at this juncture that if there's an individual who has a history of alcohol abuse or a strong family history of alcohol or other substance abuse, I would never make that recommendation.
Absolutely.
But for the remainder of my patients, if they're teetotalers, I tell them that there actually is some benefit to drinking in moderation, and that's defined as about a drink per evening.
I wonder why that is. Couple things. First, I want to talk about the healthy lifestyle because, I say this a lot as I'm interviewing guests on this show. I'm blessed to be able to learn so much about so many different areas of senior living, middle-aged living, really. It's not even about seniors. We're talking about people in their 50s developing these types of things. And every show, almost, and most of my guests, no matter what we're talking about, everything comes down to how you treat your bodies, and your brain is part of your body. And I think, in the grand scheme of the busy routines in life, it is very easy to forget about the vehicle that gets you through life. And, I was a mom raising 2 kids with a career and got caught up in a very, very crazy busy routine. And I can tell you, it wasn't easy to find time to exercise. And I found myself getting heavy and not kind of feeling clouded in the brain. And as soon as I started exercising and eating well and drinking the water, my brain felt healthier as I'm watching the weight fall off and the body move easier and feel better. So, it's easy for me to say, take care of your body and you're helping your life. And we know this, it's very simple, but really I've learned to look at it like a car that sits in, maybe it's your second car, that sits in your driveway or sits in your garage or wherever and isn't used. You got to keep the oil flowing. You got to keep the fluids in the car moving around, or things get rusty, or things don't go through, or things get clogged. And you got to move the water and the oxygen and the blood in your body to keep every single cell in your body moving and healthy and continuing to rejuvenate and re-energize you. So if all you can do is start with maybe a little weight in your wrist and moving your arms, and then go from that to walking with a walker, and then go from that to walking down the street to a mile to 2 miles, you'd be very surprised at how that will impact the rest of your life, including your brain.
Yeah, and I entirely agree. If you take care of your body will take care of you. I tell my patients, and every chance that I get to speak in public, I tell people that we are what we eat. We've heard that saying before, of course, and it's making those changes that perhaps are the most difficult because we fall into those habits of not taking care of ourselves, of not eating the right foods. And it's changing those patterns that has the greatest payoff. So it's all fine and good if you take over-the-counter vitamins, but there's research to show that they are better absorbed into our bodies if we get those vitamins through our food, through fish, through fruits, vegetables. Particularly when you look at vitamin E, folic acid, it's extremely important to be consuming a good diet. And I don't have a problem with supplementing that diet with over-the-counter vitamins. But I think you're absolutely right. We need to invest in ourselves. If we want to be in this for the long run, we have to invest in ourselves. It's vitally important. And I also have fallen into the kind of lifestyle where it's difficult. And so more recently, I've taken to telling my patients what it is that I do for myself, because I would, at one point in time when I was much younger, I enjoyed going to the gym several times a week. I enjoyed weightlifting. I enjoyed aerobic exercise. I used to play a lot of racquetball. Now, having two young children and having a busy practice, I just don't have the time. So what I did 3-4 months ago, I bought a pull-up bar for my garage. And so for about 15 or 20 minutes, I will do pull-ups. I have a jump rope, which I hadn't used in 20 years, and I brought the jump rope down from the garage, and I will jump 100 times at a time. Then I'll do some pull-ups. Then I'll jump again. I'll do some push-ups. And it's not as much as I'd like to be doing, and it's probably not doing as much for my body as I once did with the more regular exercise that I had. On the other hand, the psychological benefits are tremendous. I really feel good. I know that I'm keeping the weight at bay, and it's a really good feeling. You cannot underestimate the psychological effect of just exercising a little bit. And then when you exercise a little bit, at least you have the wheels churning, and that opens up possibilities for exercising a lot. Chances are that you're not going to go from being completely sedentary to being big into exercise, but if you exercise a little, then you can take the next step. Yeah,
it'll grow, especially as you see weight come off. Okay, so I really want to get back to the neuroscience of this and the diagnosis and the treatment and the different diagnoses too. But as you're speaking, I do just want to say, for those caregivers that are noticing some memory loss, and like you said, people don't always reach out. They don't really want to know in the beginning. Everybody lives in denial for a little while. But there are some things that you can do, even maybe before you're ready. We're going to encourage you to get ready as soon as possible. But, you know, if you have a loved one, getting them out at this time of year to garden. That's a little bit of exercise. And if you're gardening and planting vegetables, that's fresh food.
Right.
And just throw fish in the oven and maybe just make small changes to the diet and see if that makes an impact while you're deciding on your next step, right?
Absolutely.
Okay, so I'm a little bit confused as to, so I assume our listeners are too, as to say, you know, my mother just moved down here. She's in her 70s. I think she's perfectly fine. But if I were noticing some memory loss, what do I do? Do I go to a primary care physician? Do I go to a neurologist? Or do I go to the neuropsychologist? What are the differences in the roles there, and how do you determine what your first step is?
Sure. And maybe in a minute we can talk a little bit about what are the things that you should be looking for in your mother and in other people. What are the earliest signs of memory loss? Typically, I recommend that patients, if they already have a good established relationship with their primary care doctor, that's probably the first step. If you yourself notice that you're struggling with your memory, or if you notice that a loved one is having problems. The primary care doctor, whether it's internal medicine or family medicine, will only have so many tools available to her or him in order to evaluate the patient and take the evaluation to the next level. They can do what we call mental status testing in their office, where they will ask some questions. Unfortunately, if we're trying to catch memory loss early on, oftentimes mental status testing won't yield whether in fact the person is having a problem. So oftentimes this involves the primary care doctor or his or her nurse asking questions about what's today's date, what city are we in. Maybe the patient is given 3 words to recall. Maybe they're asked about current events or who's the president and who's the vice president and so forth. And sometimes if there's sufficient memory loss, the patient will struggle with some of these questions. However, there are many individuals who are beginning to experience memory loss who will be able to answer those questions flawlessly. And those are the ones that we don't want to miss. Again, we want to diagnose this early on. And so
I imagine a lot go undiagnosed for a while until it gets further down the road.
That's right. Many go undiagnosed. And so what happens is that in their doctor's office, they will receive this mental status testing over the course of several years. And then when the doctor sees that there's actually a change in the person's mental status, they may make a referral at that point in time to a specialist. But in the meantime, we may have lost years, quite literally, in making an early diagnosis.
Important years.
Yes.
So what are some signs and symptoms to look for if you are a caregiver or even a patient? If it's yourself, what are the first signs that you maybe need to go and get checked, because earlier diagnosis is better because you can get treated sooner?
Absolutely. Well, the Alzheimer's Association puts out the 10 warning signs. And when I present in public, I kiddingly say that I've come up with my own much simpler 3 signs, and that being memory loss, number 2, memory loss, and number 3, memory loss. And so that's really where it's at. If you want to catch a dementia early on, and more specifically Alzheimer's, because Alzheimer's affects memory centers of the brain, then you want to look for memory. And when I talk about memory, I'm talking about short-term memory, an individual's ability to recall things from the near past, meaning yesterday, the day before, last week, few weeks ago. So early in the course of dementia and Alzheimer's, long-term memory is preserved. What we're looking for are problems with short-term memory. And so if the individual is forgetting recent conversations or details of recent conversations, if the individual is repeating themselves, repetitiveness is never a normal thing. And so sometimes I'll have well-meaning adult sons and daughters come and bring me their parents, and they will say, well, mom's been repeating herself for the last 2 years, as if that was a normal thing. And I think to myself, we missed an opportunity earlier on to catch this. So repetitiveness is never a normal thing. Okay. And by that, let me be specific. It's a person who asks the same questions over and over. And it could be in a short span of time, or it could be from one day to the next, or if the person is telling the same story over and over. And again, it doesn't necessarily have to be in a short span of time, although the more advanced Alzheimer's, the more likely that they will repeat themselves in a short span of time.
And at that point, if you're noticing these symptoms, that's when you call step 1, your primary care physician.
Yes, I would say before you notice the repetitiveness and when you're just catching the mild memory loss, where people are forgetting their upcoming appointments, they're forgetting details of conversations, they're misplacing things and unable to find their way back to them. That's the point in time when we want to catch the individual.
Okay. And before you're probably ready, because you're in denial, what are some good resources for them to go to? Alzheimer's Association, to look up and research some information?
Absolutely. Alzheimer's Association has a wonderful website with lots of resources. I tell spouses and adult children, if mom or dad, if they were bleeding from their mouth or from a tooth, you would find a way to get them into the dentist's office. So I say, find a way to get them to a specialist. Make up a lame brain excuse if you need to. Say that their primary care doctor wants them to see somebody. Hopefully that's in a truthful manner, but bending the truth a little bit in order to get them to a specialist. You have to be the advocate. And sometimes primary care doctors will serve that purpose very nicely. Oftentimes they do, but sometimes honestly they don't. And so families will have to circumvent that first step so that they can get to the right person.
Okay, we have so much more to talk about. We have to talk about the different diagnoses, the treatments, what we can do when we find it early. So I want y'all to stay with me. We will be right back with even more, or I should say, additional important information that we want to get out to you. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Welcome back. I'm Jean Pete, and just to remind y'all, I'm here with Dr. Alfonso Martinez, who is a neuropsychologist or memory specialist with the Neuropsychology Center here in Peachtree City, Georgia. Dr. Martinez, we've had a great first half hour, but we have so much more to get to. But just to recap, We talked a little bit about the role of a neuropsychologist. We talked about early signs and symptoms of memory loss and why it's so important for folks to recognize that there are some signs and symptoms that are a little bit more than everyday aging, like repetitiveness and more memory loss than you're used to with your loved one. And the importance of going to your primary care physician and asking for some sort of an evaluation and for referral to a specialist to make sure we get to the bottom of things if you really see a difference in your loved one or yourself early on. So let's talk about the different diagnoses. Someone has been referred, Alzheimer's or dementia. What's the difference?
Okay. Dementia is a medical term, and it means that the individual has suffered a change in their cognitive functioning. And within that, we include memory, of course. And the change in their cognitive functioning is sufficient to cause difficulties in what we call activities of daily living, which involve ability to do your banking, to remember to take your medications, to make and keep appointments. Dementia can be caused by a number of different neurologic diseases or neurologic insults. It could be related to a traumatic brain injury. It could be related to a stroke. It could be a brain infection. So there's many things that have the potential to cause dementia.
Now let me ask you, and we'll continue to go here, but just to sidebar a minute. If you have a brain injury, say you get in a car accident and you hit your head on the ceiling of a car, whatever, you're fine, you go on living, but that could trigger a dementia. Is that also a progressive disease, or will that just affect memory loss and that's where you stay?
That's a great question. Dementias don't necessarily have to be progressive, although in medicine, whenever we talk about dementia, usually we're talking about a progressive condition. But technically speaking, they don't have to be progressive. So after a head injury, oftentimes people will have what's called post-concussion syndrome, which means that for a period of time, they may have some degree of memory loss. They may have retrieval problems or difficulty accessing memory. They may have some word-finding problems. Depending on the severity of the head injury, many of those things tend to resolve over the course of weeks and months. Now, there are studies to show that people with severe enough traumatic brain injuries earlier in life are predisposed to develop Alzheimer's many years later. And you may be aware of some of what's coming out now in the NFL with players who have had, not dozens, but probably hundreds of concussions, how they're developing Alzheimer's at a greater rate. We know that even for non-athletes and people who have just been in a car accident or suffered a serious fall and had a head injury sufficient to cause loss of consciousness, those individuals also are at increased risk for developing Alzheimer's perhaps many years later. But it's not a perfect correlation, as you might imagine, so that not everyone who has had a previous and serious head injury should be concerned themselves.
Okay. Because, as we're talking, I'm sitting here thinking, I lead a really busy life. I forget appointments. Sometimes I repeat myself, sometimes forget who I said what to. And so I'm thinking, oh my gosh, I was in a car accident. Maybe I have dementia. There has got to be a line between the way we lead a busy life. How do you know?
Well, that's a great question. I mean, in an individual below the age of 65, just statistically speaking, the chances that they're going to develop Alzheimer's is pretty low. But fully, perhaps 1 to 5% of everyone who develops Alzheimer's will be below the age of 65. So although it's much more prevalent in older folks, there's a subgroup of people in their 50s and sometimes even in their 40s who will develop Alzheimer's. And I see some of those patients in my office. There tends to be a stronger genetic connection when we're talking about early onset Alzheimer's, meaning before the age of 65. So when you see those cases, it's pretty common for them to have had family members who also developed Alzheimer's early on or before the age of 65. In an individual older than 65, if there are seeming memory changes where the patient themselves or family members are thinking, well, there seems to be a change here. it's not very dramatic, but there seems to be a change from previous functioning, then the way to make the distinction whether it's normal aging or whether it's the beginnings of dementia is by way of examining them and through a neuropsychological evaluation, which is what I do in my practice.
Okay, you brought me right back to where I wanted to be. Great. Okay, so you go to the primary care physician, but it's really difficult to find out if it's truly just normal aging or if you really have something going on. And a lot of times it's just the caregiver or the person, that says, but something's not quite right.
Right.
So it could easily be missed. Well, what do you do if the doctor says, well, you're fine? You want to believe it. So I imagine a lot of people leave and they don't get tested for years down the road when it gets worse.
That's true. And again, I want to reiterate that there are many, many good primary care doctors out there.
Well, it doesn't mean that they're not good.
Right.
It's just that's not really their specialty, right?
That's exactly right. And so I would say that if you have concerns about yourself or about a family member, the first route is going to the primary care doctor. But if you feel that that your concerns are not being heard or they're being dismissed too casually, then I would say go to a specialist. And a specialist can either be a neurologist or a neuropsychologist. The neuropsychological evaluation involves direct testing of the person's memory and other mental faculties to find out if they're exhibiting changes that are outside what's normal for just the aging process. And so all of the tests that neuropsychologists use have what we call normative data, which allows us to compare the patient to other people their age, because we know that with the normal aging process, there is a bit of decline in memory and mental functions. Now, these declines tend to be relatively mild, and there were studies that were done in the 60s and 70s that showed curves of memory decline that were rather significant, and now we're finding out that that's probably because many of the individuals in those groups that were studied actually had Alzheimer's. And so when you have a large group of people who are in their 70s and 80s, and you're not screening out for who has Alzheimer's and who's just normally aging, and you put those all in a large group and you look at what happens, yes, there will be significant decline in memory in these large groups, but it's because they're, in a sense, tainted with many individuals who have Alzheimer's and other types of dementia. So there is some degree of memory loss that comes with the normal aging process. It's relatively mild, and much of it has to do with retrieval problems, meaning that the information is still stored in the brain, but the individual is having a hard time pulling that information back out, and that's what retrieval problems relate to. But anything that looks a little different, and let's say, sometimes stress can create memory loss, sometimes depression, anxiety, even to a certain extent, hearing loss can create some seeming memory loss. It's not true memory loss, but if the person is not actually bringing information into their memory or encoding information the way that they should because they're not able to hear what's happening in their environment, then it's going to look like they're forgetful. They're not truly forgetful. They're just missing out on what's happening around them. So you're absolutely right that there are many conditions out there, normal aging included, that may look like memory loss, and we don't want to inappropriately identify those cases as people who have dementia or Alzheimer's. And that's where the evaluation that I do comes in and is extremely helpful in making that distinction.
And, I'm completely objective, not to be subjective about Dr. Martinez here, but here's my thing. As I'm in my middle ages now, I am learning much, much more innately and acutely to go and trust my gut, go within myself in decision making, in my career, in my thoughts on my children as I'm raising almost teenagers now. If it's in your gut, if something is telling you something is just not right, if you're bringing your loved one to a primary care physician or an internal medicine physician and you're saying, you know what, I'm concerned, I would almost say go. Make sure you push for that evaluation, because the best thing that could happen is, nope, normal aging. Right. But the worst thing that can happen is you don't go and get tested, and then you're 2 years later down the road before you find out.
Right.
So go with your gut. If you know innately, because you know yourself or you know your loved one better than anybody, you're with them every day, push, just like we have to push for our kids. We have to push for our spouses. We have to push for our parents. Somebody needs to advocate. And it's not at the fault of any doctor. They don't know them as well as you. And what I also hear is in the early stages, people are very keen and good at compensating for their memory loss. So they can appear to a physician that doesn't see them regularly about memory loss to be okay.
That's exactly right. And when I see patients who come in and maybe they're apologetic because they feel like they may not have a problem, I say to them, that's my favorite patient. The folks who come in and turn out to be part of what we call the worried well, meaning that they think that there's something wrong, but there's really not. And maybe they come in because there's a strong family history. Those are my favorite patients. I thoroughly enjoy at the end of a week where I've had to deliver the Alzheimer's diagnosis to, half a dozen people. There's nothing that makes me happier than to sit with a patient and family and to say, hey, we looked and looked but couldn't find anything wrong. And so in those cases, there's a value first in knowing that there's nothing wrong. And a second value is that we've established a baseline of that individual's functioning. And so like that, should they return a year, 2, 3 years down the line, we already have that baseline established. Where with the first time that we see a patient, the best that we can do is compare them to that normative data that I made mention of. So there's a big value in having that baseline. And by saying this, I'm certainly not suggesting that everyone, race to your nearest neuropsychologist and have this kind of an evaluation. But rather than when you're concerned, and I think, Gene, that you brought up a great point, when something's wrong. You know when there's something wrong with you. You know when there's something wrong with mom or dad or with your husband or wife. And I think you have to go on that gut and get an appropriate workup.
Okay, so now, there's so much to talk about, but I'm trying to help folks because I, unlike you, haven't gone through this process. Okay, so we go to the primary care physician or the internal medicine physician, our family doctor, who's been seeing us for our vitamins or health, physicals, whatever. We realize, okay, well, maybe there's a need for a further evaluation. At that point, where's the best place to go? Do you go to a neurologist or do you go to someone like you who's a neuropsychologist? What's best?
Yeah, that's a good question. As a rule, I would say that if the only change in the patient is their memory and their ability to remember, going to a neuropsychologist is a reasonable next step. If there are other signs that coincide with the memory loss, things like headaches or dizziness or imbalance or tremor or rigidity, double vision, these are other neurologic symptoms that need to be examined. And in many of those cases, primary care doctors will make a referral to neurology. I would say that's the distinction I would make. I would say that if the problems appear to be only in memory, perhaps word finding, cognitive issues, then I would say that a reasonable next step would be
the repetitiveness maybe that you talked about earlier.
Yes,
okay.
Then the reasonable next step would be to see a neuropsychologist. I should tell you that the vast majority of my referrals and that of the typical neuropsychologist come from a neurologist. So oftentimes we're not working in competing roles, but actually complementing each other. And so I do receive some referrals directly from primary care doctors, but many of my referrals come from neurologists because the primary care doctor oftentimes will refer to the neurologist to have that exam done. And either way, it's an appropriate step. The neurologist, similar to the primary care doctor, now has, of course, a higher level of sophistication as it involves memory loss, but they also don't have the tools to examine memory at a greater level or a greater depth. And so there are neurologists who sometimes won't refer to a neuropsychologist, although their patients are complaining of memory. A brain scan, MRI or CT brain scan, is a typical...
That's the first thing you think of.
Sure,
that's what they're going to do.
Right. And that's a typical and necessary part of the workup. but it only gets us so far. The way that I explain it to my patients is that it's a great tool primarily for ruling out possibilities. And it allows us to rule out brain tumors, something called hydrocephalus, which has to do with too much water on the brain. It looks at strokes. It looks at brain inflammation. So there's a number of things that need to be examined by way of a brain scan. So it's an absolute necessary but not sufficient part of the dementia workup. And so that's the way that I look at it. You need to have that, but that's not enough. And so if you have a doctor, regardless of whether it's a primary care doctor, neurologist, psychiatrist, who has done a brain scan and has said the brain scan looks normal, you have nothing to worry about, and your concern primarily is about memory, I would say to you that's inaccurate because with the technology that we have nowadays, Alzheimer's and other dementias won't show up on the brain scan.
Okay. So it really seems like if this is a diagnosis, you're not doing yourself a favor by not taking that third step and going to the neuropsychologist.
I'm a little biased, but I would say that that's accurate.
Well, and so then I want to help the folks understand why that is, because my brain's going a mile a minute at the moment. So when they get to you or a neuropsychologist, how do you help? What are some treatments that you put in place? Can you slow the progression because they've been referred to you, who is a specialist in helping them with the memory and cognitive function of the brain? Let's paint the picture for them why it's so important not to stop at the neurologist, but to take it one step further.
Right. Well, first, let me say that neuropsychologists are doctorate level individuals, primarily with PhDs. And I'm a PhD, and then there's some psychologists, clinical psychologists, who have a similar degree called a PsyD. Either way, we are not prescribers, and so I don't prescribe any medications, nor do any other neuropsychologists. So in that sense, we work closely with physicians, whether they are primary care doctors or specialists.
But I guess when I say treatment, I'm not just thinking about medications. So
Sure.
How do you come into the traditional medicine world, working with them?
As it involves dementia and Alzheimer's, we are a very important part of the diagnostic process, as I've already told you. And so just to give you a little bit of a sense of what's actually involved during a first visit, if the question is one of dementia or Alzheimer's, usually I will meet with the patient and hopefully a family member who comes along. And I should say to your audience that it's vitally important for patients to go in not by themselves, but with a family member who knows them well, because it's very important for us to have a full picture. And people who are experiencing memory loss themselves oftentimes either don't recognize that they're having these problems, or they tend to minimize these problems. And so very important to have a family member along.
Oh my gosh, we have to talk about this. My father had cancer, and I'd hear him at home. Oh no, I'm okay, darling. Oh, and I'd hear him moaning and grunting, And we'd take him into the oncologist, and he'd get there, and Dr. Norman would say, "How you doing, Dan?" He'd say, "Oh, I'm fine, Superman, Man of Steel." Drives me insane, because I know I'm living with him that's not true. And so regardless, let's not even put memory loss in there. You got to have somebody go with them to the doctor, especially if they're a male. I'm so sorry, but that's true.
It's absolutely true. There's something about that greatest generation where people feel like they've been through all this. They've been through the Great Depression. They've been through at least one of the wars. And so they feel like, they shouldn't complain. They should just suck it up. And so I agree with you that there's that attitude.
No matter what. Then you add in memory loss. It's so important. You've got to go with them.
That's right. Right. So oftentimes if I don't have someone who comes in with the patient, I will ask the patient permission to get in contact with a an adult son or daughter in town or out of town, it doesn't matter. And oftentimes I will try to do the interview right with the patient in the room so that there are no secrets or anything like that. And so vitally important for the patient to come in with somebody. The actual neuropsychological testing, particularly if we're looking at dementia or Alzheimer's, can go anywhere between an hour and a half to 3 hours.
I was just going to ask that. And is there a large cost to that, or is it covered, or how does that all work?
It's covered by Medicare and Medicare products, and other insurances cover it as well. And then
don't be afraid.
Right. From that standpoint, there should be no cost. There might be some sort of a copay or something like that, but it should be minimal. And then at least the way that I do it in my office, usually I meet a week later after the testing is done. I meet a week later with the patient and family members to review the results and let them know how it all turned out and what it means, and importantly, what their next steps are. So we have some great medications out there. There's 4 medications for Alzheimer's. 3 fall within one category called cholinesterase inhibitors. Aricept is the one that most people have heard of or seen on television or read about in magazines. And then there's a 4th one called Namenda that came out later. And oftentimes these medications are used in conjunction. But there's a very strong psychological piece to this disease as it relates to the person who is suffering the disease and close family members. And so I try to help out on that end as best I can.
It's such a journey, and gosh, we never have enough time, but it's such a journey. From before you even get the diagnosis, you're already on the journey and you know it. And it just gets, it's so difficult every step of the way. So we want to empower you, for all of my listeners, to get help as soon as you can. And, you know, I'm just so pleased that you were here today, Dr. Martinez, and I want you to shout out your contact information if there is anyone in Atlanta that may be going through this and just wants to talk with you as well. How could they get in touch with you?
Sure. My office is in Peachtree City, which is south of Atlanta, and the name of the practice is the Neuropsychology Center, and we have a website, and the website is theneuropsychologycenter.com, and our phone number there is 770-632-1088, theneuropsychologycenter.com, 770-632-1088.
And do you have different locations throughout Atlanta, or you could help them get in touch with folks in other areas if they weren't near you in Peachtree City?
That's true. Yes. No, we only have the one location in Peachtree City.
Okay. Well, I never have enough time, but what I want you all to know is don't be afraid to go and get a diagnosis, because the earlier that you can get information, the earlier you can get treated, the earlier you can get on some medicine and to do some cognitive exercises, all of this pieced together to help slow the progression of the disease, or, as Dr. Martinez said earlier, increase quality of life while you are on the journey with this disease. Is there anything else that you want to get out there, because it's already time to go?
Yeah, no, just early diagnosis is key.
Thank you so much for joining us today.
Thanks for
having me. We'll have to have you back for another show soon.
That would be great.
Thank you. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.